Untold Stories of a Medical Student, Part 2.
And the next story I'm going to tell is about the patient who wouldn't stop talking when we were suturing up his face. And he came in on a Friday night. I was working the night shift in the ED, and I'm there from 7 p.m. to 7 a.m. So at some point in the morning, around like 1, 2, 3, 4 a.m., he is there in the bed, and it turned out that he got so drunk or so high that he ended up falling and he cut open his chin. So he had this big gash right across the bottom of his chin, and it's like pouring blood, because that area of the body is full of a lot of blood vessels. It's going to bleed a lot. It looked really, really, really gruesome. But this kid was so drunk that he couldn't even feel any pain. So we finally show up to stitch up his chin. And one of my friends, this is another fourth year medical student, she got volunteers to do the stitches. So the trauma resident is showing us how to do stitches on this patient's face. And mind you, like, I already know how to do stitches. Like, I've learned a few times and I've done a few, but my co-medical student was doing it and the resident was giving us tips. You know, she's telling us what level of thickness to use for our suturing materials, how to use your needle, how to turn your hand with a needle driver in order to protect yourself and get the best stitches, especially on someone's face, because you want the scar to be as small as possible. So prior to all of this, I go up to this patient and I'm letting him know, like, hey, we're gonna be suturing up your face. And he just starts laughing. He's like, and I'm like, oh, what the heck? I'm like, oh, I really like your outfit. And he's like, I like it. I'm dying over this kid's reactions. So I'm like, okay, whatever. Finally, we start to do these stitches, and and it's like, it's me, I'm on one side of the patient, there's a third year medical student next to me, and then another fourth year colleague of mine who's at the foot of the bed, and then my friend who's doing the stitches, and then the resident who's at the head of the patient in order to observe and make sure that nobody like messes up this kid's face for the rest of his life. So my friend, she starts to do stitches on this patient, and she does the first stitch, but she's like, something was not clicking. I mean, it's 4 or 5 o'clock in the morning at this point, and she was having difficulty with doing simple interrupted. So instead of continuing to do multiple like loops with the suture, she was supposed to make one loop and then tie it off, cut it, and then do another loop. And something was like mishapping. I mean, there was like a mishap going on, and the way that she was trying to make her knot, she had like the tail of the string a little bit too long, so it was kind of getting caught. So the resident steps in and says, okay, no, like, look at how I'm doing it. She's like, every time that I pull tight, I switch sides, like I switch directions, and that helps make a really tight knot, and I know where my needle is at all times. And the funny thing was that while this resident is speaking to my friend and teaching her about how to do the suture and how to tie this knot, the patient is like, yeah, yep, I got it, okay. And so the resident's like, okay, so make sure that when you bite in, you want to make sure your needle is perpendicular to the skin, and you want to bite into the next side at the same level. So don't like grab the skin and bite in twice. Just go once through, all the way through. And the patient's like, okay. I'm crying of laughter, and so is my other fourth year colleague, because we're not talking to this patient. Like, we're not giving him instructions. My friend goes ahead and she follows the instructions. Okay, much better, good job. And then the resident says, all right, so when you're gonna tie your knot, make sure that you loop it around the needle driver 3 times and then pull, and then the next one just loop it around once, and keep doing that until you finish the amount of knots you're gonna do for that specific stitch. And the resident's like, you understand? And the patient's like, yeah, I got it. It was the funniest freaking thing ever. Oh my God. So we finally finished all the stitches for this patient. Finally, the patient was discharged, but that was a very, very, very funny way to end the night. Okay, now I'm going to tell you guys about the time that I got roasted in the OR. So this was during my surgery rotation, which was like my 3rd rotation of 3rd year. And at this point, I was really scared because surgeons are scary. And I was with like one of the head doctors in surgery, and he's a general surgeon, and we were going to take care of this patient who had cholecystitis, which is basically inflammation of the gallbladder, and it causes pain, especially whenever you eat like greasy foods, and it gets to the point where it can get infected and then it needs to be taken out. That's basically the treatment. And it's very common, especially in women, to have your gallbladder taken out. So I'm about to see this surgery. And the residents are like, oh, you know, you guys really should come see this surgery. Somebody needs to be in this surgery. It's going to be interesting because it's an open procedure. And at that time, I didn't really know what open meant. I mean, I knew that it wasn't going to be with the cameras, which is laparoscopic, but I didn't know if open meant like I'm going to be able to see so much more, or if it meant opposite of that. So I go, and we're about to do the surgery on this lady, just confirming with her, okay, you know what procedure we're gonna do, like, you know what's going on. She's like, yeah, I know. We have to make sure that, you know, we know her medical history and it's the right patient, of course, going through all those checks and balances. And now finally it's time for the surgery to start. So we go, and they put on like a sheet that only shows the area where we're gonna do the surgery, which is on like her upper right side of her stomach, of her abdomen, underneath the ribs. And they put, you know, the cleansing solution, the betadine, and go in with the scalpel. And that's when I realized open is open, meaning that they're cutting deep into her and they're gonna make a big hole essentially into the space where they need to do the surgery. So I'm there and I'm trying to watch, and there's like some blood and there's some fat, and he's asking me like, what type of fat is this? What type of tissue is this? And we're going through the different layers until we get to where the gallbladder is. Finally, there it is, the gallbladder, and we see how it's big, and we see that it's kind of like torn open. What happened? And we see that there's some pigment that's gone to other places within the abdomen. So all of that needs to be cleaned up in order to finish this surgery. So we have to find the right arteries in order to block off the blood supply to the gallbladder before we cut it, because we don't want the patient to be bleeding out after we cut the gallbladder out. And part of my job as a student was simply to retract. So I get this big retractor. It's like this kind of like L-shaped sort of thing with like a flat edge, and I'm hooking it under this patient's like skin and ribs area, and I'm supposed to pull back as much as I can in order to increase visibility for the attending to look down into the hole and basically get what they need to get. And there's 2 other residents who are working too, and I'm like, I don't know, I don't really do forearm exercises like that, but I'm just like pulling with all my weight on this freaking retractor, trying to get things out of the way. And the attending is like, you're doing a good job, you're doing a good job. And I'm like, oh, thank you. And he's like, you're probably one of the best medical students I've ever worked with. And I'm like, this is weird because all I'm doing is retracting. After some time, he's like, is this your first surgery? And I'm like, yeah, it is. And he's like, oh, well, you know I'm kidding, right? Like, you were kidding about what? Kidding that I was doing a good job? I don't know. I assume that that's what he's kidding about. I don't know. I still don't know to this day. So that surgery took like 2 or 3 hours, and I was kind of just like dying, just wanting to get out of there as much as I could. But finally, like, he finishes cleaning up the area and then starts to get into the process of suturing things up. And part of the suturing process is that you need to suture up the fat underneath the skin, and then you suture up like another layer of, you know, it's called fascia, and then you suture up the skin itself. And so the first thing that my attending is suturing is like the kind of fatty, like loose tissue underneath the skin. And he's like doing these huge like loops and loops and loops. He's pulling super tight to get all this fat to kind of stick together. And he's like, that's definitely gonna herniate. That's definitely gonna herniate. And I'm just trying to imagine this lady like some point in the future with this like bulging piece of intestine kind of sticking out, because that's what a herniation is, after the surgery. So we finally finished the surgery, and so one of the residents scrubs out, the attending, he leaves, and then it's me and this other resident, and she's suturing up the cut that was left of the abdomen. She tells me, okay, we're done, you can degown. But obviously, as a medical student, I can't leave. You need to stay with the patient until they're in the PACU. A chief resident comes in, and he's just like, oh, so you just left the resident like on her own to work on the surgery? Like, oh, you're just letting her finish by herself? And he's giving me all of this attitude because I took off my gown, I took off my gloves. But the resident who is below him, she told me I could take my gown and gloves off. So I don't know. It was one of those things where it's like, you're damned if you do and you're damned if you don't. And this lower resident, this lower year, wasn't going to stand up to her chief and speak up on my behalf. So I just ended up looking like I didn't do anything right. So yeah, there was that. Okay guys, so those are just some of the things that have happened to me as a medical student in the hospital. I hope you enjoyed it, and I'll see you guys in the next video. Bye!